across to SABC News reporter Chriselda Lewis, who is at Modderfontein at this hour. Chriselda, very good morning. Perhaps as we look at some of the key challenges and issues that are obviously coming to the fore, what solutions or strategies are being proposed today to make healthcare more affordable and accessible as we speak?
Well, Liesl, a very good morning to you. We're still at the Government Employee Medical Scheme Symposium, which is taking place here in Modderfontein in Johannesburg. So a number of delegates within the sector have come together, to talk about a number of things, digital transformation, accessibility to the scheme, as well as affordability. These are some of the issues that I mentioned in the earlier crossing that I have. So what these delegates will try to do, especially when it comes to issues relating to digital transformation, there are some experts that I understand you will also be part of, a team of panelists here who will give expertise on how medical aid schemes, in this particular instance, GEMS, would be able to evolve with the times that are evolving, of course. GEMS would be one of those medical schemes that will also need to move with the times. If we talk about digital transformation, how does it become more accessible? How does it become more affordable for public servants? Let's speak now to Dr. Vuyo Gola, who is the Chief Operating Officer. Doctor, thank you very much indeed for joining us this morning. We can talk all day about a strained healthcare system in South Africa, but how do you provide value, for public servants under those conditions?
Chriselda, thank you so much for having me on the show. It's an exciting day, and we are here to talk about exactly that, creating value in an environment where there's ever-rising costs. The member contribution increase for 2025 was on average 10%. GEMS was one of the higher, contribution increases. So we need to make sure that we embrace the change, we embrace our size, and as you said, we use technology, but also remember the healthcare needs of our members to make sure that we provide value. We create benefits that will make our members healthier. We enroll them in programs. We screen. We make sure we prevent. We always start with preventative care to, prevent disease progression, but also making sure that those that have particular conditions are actually optimized. That will decrease the value. We also need to make sure that we tackle things like fraud, waste and abuse, which are a threat to the sustainability of medical schemes. So we look forward to a really nice day of all those conversations to make sure that we still bring value. And value also includes the price to make sure that we still remain affordable to our members.
Yeah. But those public servants could argue, salaries are not rising, but you have medical aid prices rising. How do you balance that? If you've got a public servant who's watching this from home thinking, that medical aid is a little bit expensive, but my salary is staying the same. Those are some of the intricate issues that you need to traverse.
Absolutely. Salaries are not rising. The cost of healthcare is rising way above inflation. So we need to find ways of leveraging our size as GEMS. We cover 2.4 million beneficiaries. We need to leverage our size to try and get the best value for money for our members. We need to make sure that we focus on prevention to reduce cost. We have to make sure that we use innovation, technology to just bring services where the members are and tackle various things and needs of our members, because all members are different. It's not a one-size-fits-all situation. Every member has a different need. We just need to make sure that we cater for those while we still leverage our size to make sure that we get the best value for our members.
And I think that would be important if we talk about 20 years of GEMS. It certainly cannot be a one-size-fits-all approach 20 years later. So much is evolving. I'm very excited that you're speaking about the digital transformation issue of it as well. You cannot remain stagnant. So within this 20 years, what is it that you celebrate, and how do you plan to ensure that perhaps the next 20 years we see a different GEMS, a GEMS that is more transformed digitally and is also best to serve, public servants in the manner in which they would want to see themselves covered?
So over the last 20 years, we've evolved. The list is very long. All I can say is at GEMS, we are not a passivist funder. We are very active. We're an activist funder because we are intricately involved in the benefit offering that we provide to our members. We make sure that we cater to the member needs. So every medical scheme is faced with an aging population, right? So people are getting older and sicker. We need to make sure that we still take care of those members. We still need to take care of the healthy because we don't want the healthy to yes, exactly. So we need to continue to evolve. We always have to go back to see, is what we are offering bringing value, bringing value to our members. Sorry, we also need to make sure that in an ever-changing, COVID, I think, taught us a lot of things in terms of how to do things differently. Let's embrace change. Let's embrace technology. There's a GEMS member at every single corner of the country. How do we reach that member that has to walk 5 kilometers to go to a healthcare service? We need to make sure that we bring that care to them. We need to make sure that we use digital communication to reach members. So we look forward to continuing to evolve. We have to evolve with the times. We have to stay relevant. We have to remain sustainable.
Dr. Vuyakola, thank you very much. We do appreciate your time. I know we have to go inside. The symposium has already started, as I indicated, at Liesel. These experts coming together here today to dissect some of those key issues. How does this particular sector evolve? There's so many aspects that need to be spoken about, including digital transformation. How do they reach every single member, as Dr. Vuyakola, the COO, had mentioned?